to Awaken Health Pod. I'm Jennifer Grogan, Integrative Health Coach with Greenleaf Wellness in Central Illinois, and I'm with my co-host, Shauna Scradell, Integrative Health Coach with Inspire Wellness for You in Arizona. Shauna, go ahead and share with our listeners our topic today.
Our topic today is on the benefits of massage and health. Today is March 19th, 2018, and we are recording episode 14. We have a special guest speaker, Mr. Terry Rosen from Peoria area in Illinois, who is a board-certified licensed massage therapist and certified in precision neuromuscular massage therapy. Hi, Terry.
Hello, Shauna.
As we begin, would you explain a little to our listeners on what precision neuromuscular massage therapy means?
Of course, I will explain it. Precision neuromuscular massage therapy is a mouthful, isn't it?
A little bit.
So let's just call it neuromuscular therapy, or let's just say PNMT. How's that?
Okay, cool.
Sounds good.
PNMT is, my friends, a problem-solving approach to soft tissue therapy. It requires a higher level of skill and level of deeper understanding that a therapist must acquire through painstaking seminars, but you are able, by the time you get done, to explain to the patient all the questions they may have ever had about what is this and what are you going to do to me. The PNMT sessions are not a formula, but each session is tailored to your needs.
Oh, I like that.
The PNMT is, well, Shauna, it's really a way of thinking to apply clinical reasoning, of which you don't know that I have been a CVICU nurse, but I was going to tell you that in this, but in soft tissue therapy. But you know what I realized? That most all my patients that come into me have hard tissue. So why do they call it soft tissue? Because that's what it was when God created them. Anyway, that's that.
Okay, very cool. Thank you. Jen, you've known Terry for 11 years, is that right?
That's right.
Would you share a little bit about how you met and how massage therapy helped you?
Absolutely. I know in the recent podcast I had mentioned that I had seen an integrative doctor. Well, while I was seeing her, she highly recommended that I go see Terry due to some issues I was having in my body of tightening and stuff. When I had fallen when my kids were little, I was actually in the grocery store parking lot, and my 15-year-old then was about 2, and I was holding my 13-year-old, which then was around 1, and my 2-year-old stepped into my feet and tripped me. Well, what happened was I turned my body completely sideways to keep from falling on my little baby and on my 2-year-old, and it twisted my neck and my back and my shoulders up, but I ended up getting what was called whiplash from side to side from the impact of falling. And while I was seeing Terry, not only through prayer of healing and just through his hands of work, I was able to release the tension and get my body back in shape to where I now have full range of motion in my neck, my shoulders a lot better, and my lower back.
Wow.
So I won't go to anybody but Terry. I highly recommend him. His love for God is huge, just very warm and very healing from the moment you walk into his atmosphere of his office. So that's how he helped me through a lot of massage therapy. And I know, Terry, that when I've come in to see you, you've always done like what's called fascia release. Can you explain a little bit about that and how that helps with stress?
The myofascial release, is that what you're talking about?
Yes.
Yeah, the myofascial release is something that, it's a soft technique, but it's safe, very effective, and it's hands-on. And it involves applying a gentle, sustained pressure into the myofascial connective tissue restriction. Now that's a mouthful, but your body, your entire body is full of the very superficial tissue connective tissue called fascia. And I don't know if you've ever heard of that, but it can get as hard as steel if you have a trauma, of which Jen had. Myofascial connective tissue restriction will restrict you from your movement, so that's restricted range of motion. So this kind of fascial release will eliminate the pain and restore that motion. So what happens during that is that when a low, gentle pressure is applied to that, the fascia moves and it becomes a liquid, practically. Isn't that wonderful?
Wow.
Yes, it truly does work. So, yeah. In fact, in the past podcasts that we had done, I always talk about the massage therapy and how that benefits. And if you're stressed, the fascia can tighten a little bit. So I recommend to my clients, try massage therapy because it does release and it helps with the stress. Now, Terry, another question I have for you is I was coming to see you due to some of my circumstances with the whiplash. I believe it was every week. What do you recommend depending on the client's severe injury to not as severe? How often should they come to you for massage therapy?
Well, they should probably come compared to what they're going through. In other words, what I see most of all, I see people that come in and you wouldn't think of an injury being posture, would you? But I see more people with posture injury, and that's people that stand up and sit down, and they do it all with improper posture. And when they're coming in with those tissues, the tissues under trauma itself, so I have to release all that through whatever, the myofascial release or the precision neuromuscular therapy. But there's others that you can use that would allay some of the anxieties they come in with. What are you going to do? And I talk through the whole thing if they're not just looking for relaxation. But they need to know that posture is very important. And so I do a lot of teaching, a lot of instruction. So they don't have to come in 3 times a week or 1 time every week. They might be able to get to once a month. And when they come in and we perform the disciplines that we do, it depends on the very thing that they're going through. And there's a lot of things going around today that some of the things that we hadn't even heard of, and I think you have now heard of, called fibromyalgia, and now arthritis, which is just rampant.
Absolutely. That's very interesting.
I have one more. Go ahead.
Go ahead.
Well, you had mentioned the arthritis and fibromyalgia. Do you see a connection between the way people choose healthier food options and massage therapy and benefiting that in playing a role in healing for fibromyalgia or arthritis?
Well, fibromyalgia, that is dealing with, of course, fiber, yeah, but algia, the name algia in fibromyalgia is pain. And I wouldn't want to eat anything that would produce pain. But what are those things? You would have to see an integrated health coach. Would you know one?
We are here for you.
We are. So I know that
you have to see an integrated health coach. And so I would send them to you. Because
thank you.
do not want to eat things that promote and facilitate more pain than what you are experiencing.
Absolutely.
In my situation, yes, I could work on you, but I would also ask you to go and do some exercising, like swimming. And swimming is a wonderful thing to do for my fibromyalgia.
That's good to know.
I love that. So healthy lifestyles, healthy exercise, and massage all aid to disease, for examples like fibromyalgia and arthritis.
Yes.
I'm sure definitely as an integrative health coach, Jen and I, we would incorporate anti-inflammatory foods and such like that to our clients as well.
Yes, we would.
I have some questions, a little bit off subject, but what are your thoughts about post-operative massage for those who've recently had surgery?
Well, I wouldn't want to just come right out and say, oh, do this. No, I would first want to tell you that I come from the medical field. I am a healthcare practitioner now, true, but I come from the medical field where I was a CBIQ nurse. I started as a CNA and went all the way up to being a CVICU nurse. And now I want to tell you that from that, you would want to heal first before you came in to see me if you had surgery. Because
Absolutely.
isn't that a trauma?
Right, right.
Surgery. When they do surgery on you, that is trauma to your body. There's a natural inflammatory process that goes on, which may last anywhere from 70 to 72 hours, depending on the kind of surgery you had. But I would say within a couple weeks to about a month, you could come in and you could have the kind of massage that I give. But you're going to say a few things. You're going to say, I don't understand why I have this soreness because I went in to have surgery. I thought that'd be perfect when I came out.
Right.
I hear this. And they said, I have muscle soreness. And what they told me when I asked them, why do I have this? They said, well, we had to put you in position, your body in position in surgery that, we needed to, do that so it would facilitate, we would be able to cut you and stuff like that. And so they go, oh. And so that is myofascial that you need to be released and you need to have the deeper tissues worked so you can get that, getting back to quicker healing. But I can tell you this, and this is from fact, it is having massage before you have that surgery and also after the surgery, yes, but having it before the surgery is, it is so much, it leaves you with a so much quicker process of healing. Who is into healing? But who is into healing quicker?
Wow.
And I'll give you for instance, I have an African American lady that has come to see me for 10 years. And this lady just last year gave her kidney to her husband. She went and had surgery to give her kidney to her husband. I just applauded her.
Absolutely. That's amazing.
This coming year, she was told she had to have a hip replacement. And I was just floored. But she said, I want to continue the massage until I have to have my hip replaced. And I said, you got it. And so we continued. And until she had her hip replaced. And I want to tell you what happened. When she got done, I went to call her a couple weeks later, and she says, I'm up at the mall walking.
Oh, wow.
I was floored because, see, what it does quicker process of healing. And that's what I want to tell you.
I love that. Wow. That's amazing. So if someone is to have surgery and you recommend surgery prior to, or massage prior to surgery for a better recovery, how many times do you think that they should see you or a massage therapist? I'm sure it's more than just once before surgery. How could you answer that question?
Well, you know what? Regular massage is the answer.
Okay.
But regular massage for each and every individual is going to be different, right?
Right.
And so regular massage might be once a month for one person, and it might be once every 2 months for another.
Okay.
But you need to come on a regular basis according to your body. And I always tell my patients, and they love this, you know what? Let your body tell you when to come back.
I like that.
Because it's true. Your body will start, hey, isn't it time to go back to have that therapy?
Yes. Every 5-6 weeks, that's what my body's like. Time to go see Terry.
That's fantastic. What can you share for the listeners about the association between massage and anxiety? I know that massage can help anxiety. Is this correct?
Absolutely. Can I just share with you something about anxiety?
Yes.
Did you know that anxiety comes from frequently stress?
Absolutely.
And I was a cardiovascular ICU nurse. Do you know what the number one thing stress causes? When it's ultimate, stress after stress after stress after stress. And what I mean is, you didn't do anything to relieve it. You just let it go, right? Mm-hmm. And what it does is coronary artery disease. That's the ultimate. And if it does coronary artery disease to the stress upon stress upon stress, what are you going to want to do? to get rid of the stress at the first. It's up to you. But if you come and get massage to relieve that stress, you will have no stress before that. We want to catch you before you get to having an open heart surgery.
Wow.
Absolutely. Yeah, definitely anxiety is caused by repetitive kind of negative influencers. Is that correct?
Yes. So what I would say is that if you want to continue your stress relief, let's call it that.
Mm-hmm.
Because when you come in and get the massage, you get stress relief. You will relieve it. You will get done with it. You will go home. You will have lifeblood in you. You will have energy, and we'll talk about that in a few minutes.
Okay, and what about for those who are anxious or nervous about getting a massage for the first time? I know not everybody is extremely comfortable with it, and some more so than others. Do you have any suggestions for how to ease that with new clients?
Oh, yes, but can I go back to the stress?
Oh, absolutely.
Can I go back to that for a second? I want you to know a little bit about me. How do I know what stress is? Number one, I was a CVICU nurse, and I do know from that perspective from my patients, right?
Mm-hmm.
I also know from the massage patients that come in.
Right.
But I do know stress, my dear friend. I know it because of this. I was an Army brat from 1952 to 1970. Do you know what that is? That is the person that had to, okay, when mom and dad said, I have to go, I have to go. And I lived in a lot of the United States. I lived in Europe, and I had to uproot and root everywhere.
Right.
I graduated in Princeville High School. How did that happen? But anyway, my parents were there, so I ended up there. But in 1970 to 74, I spent time in the United States Air Force. I enlisted, and it was the Vietnam War. I came back from there in 74. In 1974, I graduated. I went to Caterpillar. Caterpillar hired me. I thought, I've got the job of a lifetime. They laid me off in 83, indefinitely. And indefinitely laid off. Something happened to me where I thought, I am never going to get another full-time job because they're not going to hire me because I go back to Caterpillar. Can you hear me right now, or am I speaking too loud?
No, you're perfect.
No, okay. All right. I met a woman. Her name is Sharon, and I married her 1 year later, and we've been married for 33 years.
Congratulations.
Of all the things that had happened up to that point, that was the most beautiful thing that ever happened to me. Because she said to me, you know what? You'd make a good nurse. So I went into nursing school. I said, oh, no, not back to school. From 1990, then St. Francis Medical Center College of Nursing, I went to 92. Then I worked as that critical care nurse that I told you, 92 to 98. And then in massage school, and why did I change over? I changed over because the stress was intense.
Absolutely.
Maximally.
Yep.
Intense. There wasn't a week that go by I wasn't running crash cars.
Mm-hmm.
You know what that is?
Yeah, I worked in the hospital as a CNA myself as well.
Oh my goodness. Thank you. Shauna, thank you for understanding. It is just very intense. And so I've been a board certified licensed massage therapist since 99. And I have seen every patient and do an assessment, evaluation, and treatment. And I have never changed from doing that. But what I have noticed is that when they come in and they say, well, I do have some stress. Well, then I say, well, I guess we need to give you some stress relief, don't we? And we do it. That's what it is. So if you're asking me, are there people that come in and they say, well, I'm kind of scared to get massage. Yes, there is. That's because they are not explained everything that's going to happen or everything that can, or they're not explained the answers to their questions. And that is exactly what will allay their anxieties. And
Absolutely.
I had two women that came. They were young. They came from Galesburg. And I'll give you this example. It was just last month. And I said, what can I do for you? Why are you here? And they said, we want a massage. But one of them said, I'm not too sure I want one. The other one had a massage before. She was a nurse. She couldn't explain to her friend, well, it's going to be great. You have to experience it to know that. So I explained to the other one who had the anxiety, I told her, well, and this is the thing that I would want to do. I would want to find out what is causing that.
Absolutely,
you know?
yes.
And so she says, because I don't want to really remove my clothes,
Aww.
And some people are like that. And I said, you don't have to. And you should have seen the look in her face. She says, I don't? Yeah, you don't? And not only that, but through the other types of massage I have, one of the types of massage, you don't have to remove your clothes. There's no oils used. There's nothing. And you still get the best results. And she was all for it when we got done.
That's fantastic. I'm so happy that you found your passion, and I love how you look at the bio-individuality in your patients. That's what we do with our clients as well as health coaches. And it's just so important because everybody's so unique and each person's concerns or stressors or attention is held differently, I'm sure.
Yes.
Is it true that
Absolutely.
Is it true that massage can help with balance in older patients? Can you go into any detail about that? Do you have information for that?
Yes, I do. And in fact, if you're wanting to go into balance, there are kind of 11 things that I usually take them through. But we do it, slowly. But what the massage that I give or any therapist gives, if they are a healthcare practitioner, I want to say this first, Shauna and Jen. I want to say that Jesus Christ should get receive all the glory and honor from what we discussed today, for he is heaven's healing physician. And we as healthcare practitioners are instruments of that healing. And so if we're going to receive balance or harmony, isn't that a great word?
Yes.
Harmony. Yes, if we're going to receive balance, well, this is what massage will do for you on a regular basis. It will help you to maintain physical, mental, emotional health by preventing an accumulation of stress in the body. And remember we said we don't want stress upon stress upon stress?
Absolutely.
And it will increase the nutrients to your system by bloodstream, releasing and flushing the tissue cell waste.
Wow.
It can rejuvenate you. I mean, you might think, because Terry's rejuvenated, that's what I did. But anyway, restore body tissue. Having regular massage causes muscles to firm up, just the opposite of what people think. Oh, I'll become so flaccid, I won't be able to move.
Right.
No, you'll become more elastic. It's good to be elastic. And then it will prevent, release, stiffness, soreness in those muscle joints. You ask those patients that came after their surgery what they thought about the massage, what it did for the soreness. It restores the fatigued muscles faster than when you rest them. It's a very important part of a people's workout and their training programs.
I can imagine.
And then another one would be regular massage would impart a healthy radiance to the skin, and I know you ladies love that. The skin becomes softer, supple, and with a finer texture. It would also improve your surface circulation. We're heading into that cardiovascular part, Shauna.
Right.
The work of the heart is lessened. The blood production is enhanced. This results in increased red blood cells, which is the lifeblood, and the white blood cells, which is your defense mechanism. And it can have positive effects on the immune system, which is totally defense mechanism. And it can help the lymphatic circulation, increase drainage by ridding your tissues of waste.
Absolutely.
Which can prevent too much waste in the body. Have you ever felt, or have you ever heard of somebody told me I had a lot of toxins?
Yeah.
Yes. It can rid you of the waste in your body and can lead, all that toxin can lead to serious illness.
Our last podcast was on detoxification. For our listeners, if you listen to our detoxification podcast and go see Terry, then you're really going to get rid of some toxins.
relief. And you would have increase in energy. Not like mine. Mine's just a little bit of passion. But increase in energy. Better able to cope with the stresses, emotions, and problems and changes of today's life. And here's another benefit. And you're going to love this. And I know Sharon Middock would love this. Another benefit besides physical is psychological. Are you ready for this? Who wants to feel more alive? Who wants to be invigorated? Who wants to be energized? Who wants to have an increased body awareness, a reduced mental strain, and who wants to be given a renewed sense of well-being? Imagine that. That's what massage does on a regular basis, whatever your regular basis is. And some of my clients have even said that regular massage keeps them a more youthful appeal, which is in turn, it will encourage them to pay more attention to proper nutrition. Here I go. I'm going to find me a health coach.
All right.
We're ready.
Good health practices. The bottom line, ladies, is that all of us, we are all worth it, but we got to believe that. So invest in yourself, and by doing so, you take care of yourself, and this is what has the positive effect on all the other areas of your life. So I don't just do massage, I encourage exercising. I encourage them to go to you health coaches. I encourage the exercising for strengthening and conditioning. Encourage stretching for promoting elasticity. Remember we talked about that for soft tissue.
Yep.
And then encouraging active walking. That is a international exercise. It's all over the world. But you know what? People say, well, I don't know what to do in activity. Start walking. Use an odometer. Use a Fitbit. Challenge yourself. Become healthier. That's what Jen told me to do.
Yes, I did.
We agree. It's so important. I'm so thankful for you as a massage therapist to be able to help with overall health and wellness and to acknowledge the importance of course, food and lifestyle as well. I have a question. So definitely increasing exercise, but what I hear most commonly is people say that they can't exercise because they have this tremendous amount of neck or back pain. And as integrative health coaches, again, we would help with inflammation reduction and some root causes to where those stresses are coming from with those such a pains. But what is your recommendation? Obviously, massage therapy can help with this, but what are some of the most common reasons why people have neck or back pain that inhibits their motivation a little bit?
Well, first of all, I would say that neck pain, for instance, can come from forward head posture. Are you aware of what that is?
I don't know what exactly forehead posture is, but I know of a exercise or a stretch that you can do with the back top crown of your head against a wall with moving your back forward. It's kind of a weird pose, and that kind of helps realign. It's like we're always projecting our head outward when we're on the computer. Yeah. Is that kind of like the forehead? Could you explain that a little bit?
That is absolutely it, Shauna. There is another thing. Falling off your pillow in the morning. Falling off your pillow as you fall asleep on the couch, in the lazy girl chair, wherever you are. You know, your head might be on the shoulder, and it does not belong there because all those muscles, the soft tissue is shortened, tight, and they wonder why they got this huge egg knot on their shoulder, and then they have to come and see me. Mm-hmm. But the thing is, you want to be very careful of that positioning. Now they make these things that go around your neck that keep your neck from falling over. I don't know what they call them, collars or something, inflatable. But they have that. They have a lumbar support that you can use behind your lumbar body, your back, down there. Now let me tell you what I tell all my clients, that when they need a lumbar support, it's when they are complaining of mid-back, upper back tension.
Right.
and tightness and up in their shoulders. So this is what you do. You take a poor man's lumbar support would be a rolled up towel, right? And you put it behind your lower back. What you have to do is sit all the way to the back of the chair. And as soon as you connect with that lumbar support, you have relaxed the mid to upper body, the spine, the shoulders drop, the shoulders come back, you're relaxed, and you don't even understand that. You don't have to worry about it. You just go on about your work. But you have to do that there, at work, at home, and in the car. You have to do it to make it a habit. And see, when you're sleeping, that's another thing. If you are sleeping and you are not keeping your head away from your shoulder, you're sleeping. I even have some patients that sleep prone. Don't even let me go there. Anyway.
Another podcast.
You want to keep your head away from your shoulder and you're sleeping. Some guy came out with my pillow. And oh gosh, where'd he get that idea? Therapeutic pillows have been around for a long time. They keep your head away from your shoulder. And they, when you're laying on your back, keep your neck supported. Does that make sense?
Absolutely. Wow.
This is where the neck pains are coming from. Work and recreation, yeah. But it's when you're standing and sitting in improper posture. Where'd you hear that before?
Well,
So that's it.
We're going to have to look forward to a video from you on some posture education.
I can tell you, I can give you a valuable exercise right now. Do you remember what you mentioned? You said, Shauna, you said you put your head back to the wall.
Right.
And you have exercise. Well, this is called chin tuck. And Jen knows what I'm talking about because I gave it to her. But here it is. You do a chin tuck. You're straight up. Now you take a cardboard, and I'm just going to use cardboard because it's a flat piece of board, right?
Right.
And take this and you put it under your chin. Now the reason I'm doing that is because I don't want you to take your chin and go to your chest. That's not the exercise. The exercise was taught to me by physical therapy, by the way. And this, you take your head and you go straight out. You already do that. That's forward head posture, right?
Right.
But then bring it back slowly. When you bring your head back and you go straight out and back, straight out and back, you know what? This looks like a chicken, right? No, never mind. Anyway, when you do that, you are aligning. Shauna, you mentioned something about aligning, right?
Right.
The vertebra. And that's what you're doing. You're aligning the vertebra, and it makes you feel better and function better.
I love that. That's perfect. Thank you so much.
Sure.
As a professional in your industry, is there anything else particular you would like to share with us and our listeners today?
The kind of massage that I do, guys, is more like a laser than it is a flashlight. I don't go into the body and say, I don't know what I'm doing. I can't do that. I go into the body after I've talked with you, evaluated, we've talked about it. We've got everything, and we know what to do. We're looking at you from top to bottom, front to back, side to side, and we were talking earlier about balance. It is something that is very important. And people are not paying attention to their feet and to their foundation, which is their hips, their pelvis. So if you're looking for balance, you need to listen to Shauna and Jen on this.
Thank you.
Pod.
Thank you. Well, I'm excited about that. Where can our clients find you to schedule an appointment? Or our listeners, I'm sorry.
Well, they can find me. I would want to share something with you first, okay? I have a website, all right? Is that okay if I tell you what the website is?
Please do.
Absolutely.
It's Terry Rosen, Rosen, healthcaremassagespecialist.com. And remember I told you, I'm not anything special. I'm an instrument. I am an instrument of healing. And it's only because Christ. So Terry Rosen, HealthcareMassageSpecialist.com. Now, on my website, guys, I have got every modality, every type of massage that I do. And you can look at it. I'll give you, for instance, that the deep tissue, you'll look at that and go, oh, this is similar to the Swedish that I got. But the deeper pressure is beneficial in releasing chronic muscle tension. And then you look at the precision neuromuscular therapy, of which I've already talked about, the myofascial release therapy, of which I've already talked about. Then you see trigger point therapy, of which you may have had already, but then you know what it is, and it's incredible. You see myokinesthetic therapy, and you see manual drainage. You see that is very important because of swelling, and how many of us are swelling just from working throughout the whole day. We have dependent edema in our legs, in our feet, and even in the back of our pelvis. And we don't even know why. Want to know why? I can tell you why. Improper posture. But I will help you if you want to come out and see me. And where you can come to see me is 307 South 4th Street, Dunlap, Illinois.
Fantastic. Thank you so much for being with us today.
Yes, thank you so much,
You're
my
very
awesome friend.
welcome. I'm honored, and it was my privilege. Thank you for having me.
Yes. Well, for those of you listening and to all our Facebook followers, we thank you for listening. And if you have any questions, please go to our email at coaches@awakenhealthpod.com. And also note that you can find Awaken Health Pod on SoundCloud and on YouTube. And if you like the information we provide, please share the podcast with your family and friends. Thank you so much. Until next time, stay happy and healthy.